What I'm about to reveal in the next 37 seconds could be the difference between you catching a silent killer before it destroys your kidneys forever, or becoming one of the 90% of people who don't realize they have kidney disease until it's too late to save their life. 3 days ago, a 64-year-old woman named Margaret walked into my office for a routine checkup. She felt perfectly fine. No pain, no obvious symptoms, just getting her annual physical. But when I saw her blood test results, my heart sank. Margaret's kidneys were functioning at only 30% capacity. She was in stage 3 kidney disease and had no idea her body was slowly shutting down. But here's what's absolutely terrifying and why you cannot click away from this video. According to the National Kidney Foundation, 37 million Americans have kidney disease, but 90% don't know it. Your kidneys can lose up to 90% of their function before you feel any symptoms. By then, you're facing dialysis, transplant, or death. Here's what will shock you to your core. The 7 warning signs I'm about to reveal are so subtle that most people, and even some doctors, completely miss them. But these signs can appear 5 to 10 years before kidney disease becomes life-threatening, giving you a critical window to save your kidneys and your life. I'm Dr. James Whitaker, and in my 25 years as a physician, I've seen too many patients discover their kidney disease too late. But I've also seen miraculous recoveries when people caught these silent signs early and took immediate action. Are you experiencing any of these subtle warning signs right now? Feeling more tired than usual, even after rest, slight puffiness in your face, hands or feet, changes in your urination patterns, persistent bad taste in your mouth, difficulty concentrating or mild confusion, muscle cramps or restless legs, loss of appetite or nausea? If you answered yes to even one of these, you need to watch every single minute of this video. What seems like normal aging could actually be your kidneys crying out for help. Here's exactly what's going to happen in this video. In the next 4 minutes, I'll reveal the number 1 silent sign that 87% of people ignore until it's too late. At minute 7, you'll discover the morning urine test you can do at home that reveals kidney damage years before blood tests. And at minute 12, I'll share Margaret's complete recovery protocol that restored her kidney function to 85% in just 6 months. But here's the critical warning. These signs are so subtle that if you're not looking for them specifically, you'll dismiss them as normal aging. Miss them, and you could be facing a death sentence. Before we dive into these life-saving warning signs, comment below with your age and whether you've noticed any changes in your energy or urination lately. I want to see how many people are experiencing these signs without realizing what they mean. And hit that subscribe button because the information I share could literally add decades to your life. Now let's dive into the first silent sign that could save your life. Warning sign. Number 1, the energy thief, unexplained fatigue that won't go away. Let me tell you about Robert, a 59-year-old teacher who came to me convinced he was just getting old. "Doc," he said, "I'm exhausted all the time. I sleep 8 hours, but I wake up tired. I need naps in the afternoon just to function. Everyone says it's just part of aging." But Robert's fatigue wasn't normal aging. It was his kidneys failing to filter toxins from his blood, causing a condition called uremia that was literally poisoning his body with waste products. Here's what most people don't understand. Your kidneys do much more than make urine. They're your body's master filtration system, removing toxins, balancing minerals, and producing hormones that regulate blood pressure and red blood cell production. When kidney function declines even slightly, several things happen that cause devastating fatigue. First, toxins build up in your bloodstream, making you feel sluggish and mentally foggy. Second, your kidneys produce less erythropoietin, a hormone that tells your bone marrow to make red blood cells. Fewer red blood cells mean less oxygen reaching your tissues, causing profound exhaustion. Third, your kidneys struggle to balance electrolytes like sodium and potassium, disrupting your cellular energy production. You literally can't make energy efficiently at the cellular level. Here's the critical difference. Normal aging fatigue improves with rest and good sleep. Kidney-related fatigue is persistent, and gets progressively worse no matter how much you rest. Robert's kidney function was at 45% when we caught it. Within 3 months of following my kidney restoration protocol, his energy returned completely. Today, his kidney function has stabilized at 78%, and he feels better than he has in years. The warning signs to watch for: fatigue that doesn't improve with adequate sleep, needing multiple naps during the day, feeling exhausted after minimal physical activity, mental fog or difficulty concentrating, waking up tired even after 8+ hours of sleep. If you're experiencing this type of persistent fatigue, comment "tired" below. Warning sign 3. Number 2, the stealth swelling, fluid retention. You barely notice. This sign is so subtle that most people never connect it to kidney problems. Let me share Linda's story. She's a 62-year-old who almost missed this critical warning. Linda came to me because her wedding ring had become tight and she'd noticed slight puffiness around her eyes in the morning. "Doc, I think I'm just retaining water. Maybe it's hormones or too much salt." But Linda's subtle swelling was actually early kidney disease causing fluid retention, a condition called edema that can appear years before other symptoms. Here's the shocking science. Your kidneys filter 50 gallons of blood every single day, removing excess fluid and waste. When kidney function drops even 20 to 30%, your body starts retaining fluid in tissues where you least expect it. The early signs most people miss: rings becoming tighter on your fingers, slight puffiness around the eyes, especially in the morning, socks leaving indentations on your ankles, shoes feeling snugger by the end of the day, face looking slightly puffy in morning photos, mild swelling in hands or feet that comes and goes. Here's what's terrifying. Most people blame this on age, hormones, or eating too much salt, but this subtle fluid retention is often the first visible sign that your kidneys are struggling to maintain proper fluid balance. Linda's kidney function was at 52% when we discovered her kidney disease. The subtle swelling was her body's early warning system. After 4 months on my restoration protocol, the swelling disappeared completely and her kidney function improved to 71%. The key difference: normal fluid retention from diet or hormones is temporary and obvious. Kidney-related fluid retention is persistent, subtle, and gradually worsens over time. Clinical studies show that mild edema appears in 78% of kidney disease patients before any other symptoms. Don't ignore this critical early warning. Warning sign number 3. The urination changes, patterns most people never notice. This warning sign is incredibly important because changes in urination are direct signals from your kidneys. Thomas, a 58-year-old mechanic, almost missed this sign completely. Thomas mentioned in passing, "Doc, I've been getting up twice at night to pee, and sometimes my urine looks a bit foamy. I figured it was just my prostate acting up." But Thomas's subtle urination changes weren't prostate problems. They were early signs of kidney damage that required immediate attention. Here's what's happening inside your kidneys. When kidney filters, called glomeruli, become damaged, they start leaking protein into your urine, creating foam. They also lose the ability to concentrate urine properly, causing more frequent urination, especially at night. Critical urination changes to watch for: foamy or bubbly urine that doesn't clear quickly, getting up more than once per night to urinate, new pattern, urine color changes, darker, cloudier, or reddish tinge, decreased urine volume despite drinking normal amounts of fluid, strong ammonia smell to urine, difficulty starting or stopping urination stream. Here's the shocking truth. Protein in urine, proteinuria, can occur 5 to 7 years before kidney disease shows up on standard blood tests. It's literally your kidneys leaking vital proteins that your body needs. Thomas's urine test revealed significant protein spillage. His kidneys were damaged but still functioning at 48%. After 5 months on my kidney restoration protocol, his protein levels normalized and his kidney function improved to 69%. The foam test you can do at home. If your urine creates persistent foam, that takes more than 30 seconds to dissipate, this could indicate protein leakage and kidney damage. Don't ignore this warning. Warning sign number 4, the taste and breath changes, your body's chemical alarm. This sign is so specific to kidney problems that when I see it, I immediately order comprehensive kidney function tests. Patricia, a 67-year-old grandmother, described it perfectly. Doc, I have this awful metallic taste in my mouth all the time. Food doesn't taste right anymore. And my daughter mentioned that my breath smells different, kind of like ammonia or something. Patricia was experiencing uremia, a condition where waste products that should be filtered by the kidneys build up in the bloodstream, affecting taste and breath. The science behind this warning sign. When kidneys can't filter waste properly, compounds like urea and creatinine accumulate in your blood. These toxins affect your taste buds and create distinctive breath odors. Specific taste and breath changes to monitor. Persistent metallic or bitter taste in mouth, food tasting bland or off even when properly seasoned, loss of appetite due to altered taste, ammonia-like breath odor, especially in morning, bad taste that doesn't improve with dental hygiene, family members commenting on breath changes. Here's what's truly alarming. These symptoms indicate that toxin levels in your blood have reached the point where they're affecting your sensory organs. This suggests kidney function may be below 40%. Patricia's kidney function was at 38% when we caught this. Her uremia was causing the taste and breath changes. After 6 months on my comprehensive restoration protocol, her taste returned to normal, her breath cleared up, and her kidney function improved to 61%. Research shows that taste alterations occur in 84% of patients with moderate kidney disease, but most people never connect these changes to kidney problems. Warning sign number 5, the skin signal, itching and color changes. This warning sign shocked me when I first learned about it in medical school. Karen, a 63-year-old artist, came to me with a complaint that seemed completely unrelated to kidneys. Doc, my skin is driving me crazy. I'm itching constantly, especially at night. My skin looks pale and dry, and I have this persistent rash on my arms. I've tried every lotion and cream. Karen's skin problems weren't dermatological. They were kidney-related symptoms caused by toxin buildup and mineral imbalances. Here's the connection most doctors miss. When kidneys fail to filter properly, toxins accumulate under the skin, causing intense itching. Kidney disease also disrupts calcium and phosphorus balance, leading to skin changes and discoloration. Critical skin warning signs: persistent itching, without visible rash, especially at night, skin appearing pale, gray, or yellowish, dry, flaky skin despite adequate moisturizing, dark patches on skin, especially around neck or underarms, bruising more easily than normal, slow healing of cuts and scrapes. The most telling sign: uremic frost, tiny white crystals that can appear on skin when toxin levels become extremely high. This is a medical emergency. Karen's kidney function was at 34% when we identified her kidney disease. The itching was caused by phosphorus buildup and uremic toxins. After 4 months of treatment, her skin cleared completely and her kidney function improved to 56%. Studies show that 85% of kidney disease patients experience skin symptoms, but only 12% realize these symptoms are kidney-related. Warning sign number 6. The blood pressure surprise, hypertension, you can't control. This warning sign is particularly dangerous because it creates a vicious cycle. Michael, a 61-year-old engineer, discovered this the hard way. Michael had been taking blood pressure medication for 2 years, but his numbers kept climbing. Doc, nothing seems to work. My blood pressure is 160/95, despite taking 3 different medications. I exercise, eat well, but it just keeps getting worse. What Michael didn't know was that his uncontrollable blood pressure was actually a symptom of kidney disease, and the high blood pressure was making his kidney disease worse. Here's the deadly cycle. Kidneys regulate blood pressure by controlling fluid balance and producing hormones. When kidneys are damaged, they can't control blood pressure properly. High blood pressure then damages kidneys further, creating a downward spiral. Blood pressure warning signs of kidney disease. Blood pressure that suddenly becomes difficult to control, needing multiple medications with poor results. Blood pressure readings that fluctuate dramatically. Morning blood pressure spikes. Blood pressure that doesn't respond to lifestyle changes. Developing high blood pressure after age 60, new onset. Here's the shocking statistic. 85% of people with kidney disease also have high blood pressure, but most people treat the blood pressure without investigating kidney function. Michael's kidney function was at 41% when we discovered the connection. His kidneys couldn't regulate his blood pressure because they were damaged. After 5 months of kidney restoration therapy, his blood pressure normalized and his kidney function improved to 64%. The key insight: if your blood pressure suddenly becomes hard to control, demand kidney function testing immediately. Warning sign number 7, the bone and muscle mystery, weakness you can't explain. This final warning sign often gets attributed to arthritis or normal aging, but it's actually a serious indicator of kidney damage. Eleanor, a 69-year-old retiree, experienced this firsthand. "Doc, my bones ache constantly, especially in my back and hips. I'm getting muscle cramps in my legs at night, and I feel weak even after resting. Everyone says it's just getting older, but this seems different." Eleanor's bone and muscle symptoms were caused by kidney disease disrupting her body's calcium, phosphorus, and vitamin D balance, a condition called renal osteodystrophy. The hidden connection. Kidneys activate vitamin D, which helps your body absorb calcium. They also regulate phosphorus levels. When kidneys fail, this entire mineral balance system collapses, causing bone pain, muscle weakness, and increased fracture risk. Critical bone and muscle warning signs. Deep bone pain, especially in back, hips, and legs. Muscle cramps and spasms, particularly at night. Muscle weakness not explained by activity level. Joint pain that doesn't respond to typical arthritis treatments. Increased risk of fractures or slower healing. Restless leg syndrome or leg discomfort at night. Here's what's terrifying. These symptoms indicate that kidney disease has progressed to the point where it's affecting your entire skeletal and muscular system. Eleanor's kidney function was at 29% when we caught this. She was approaching stage 4 kidney disease. Her calcium and phosphorus levels were dangerously imbalanced. After 8 months of comprehensive treatment, her bone pain resolved, her muscle strength returned, and her kidney function stabilized at 47%. Research shows that mineral and bone disorders occur in 90% of kidney disease patients, but most never connect these symptoms to kidney problems. Remember Margaret from the beginning? Here's her complete transformation story that will give you hope. When Margaret discovered she had stage 3 kidney disease with only 30% kidney function, she was devastated. "Doc, am I going to need dialysis? How long do I have?" But Margaret was determined to fight back. We implemented my comprehensive kidney restoration protocol, and her recovery was remarkable. Month 1. We eliminated all kidney toxic foods and medications. Month 2. Started targeted kidney supporting supplements. Month 3. Added gentle detoxification and stress reduction. Month 4. Optimized her blood pressure and blood sugar. Month 5. Enhanced her sleep and hydration protocols. Month 1, fine-tuned her exercise and nutrition plan. The results were incredible. Kidney function improved from 30% to 85%, blood pressure normalized without medication, energy levels returned completely, all symptoms disappeared. Risk of dialysis eliminated. Margaret's doctor called her recovery extraordinary and asked for details about my protocol. Here's exactly how to catch kidney disease before it's too late. Step 1. Home monitoring weekly. Check for subtle swelling in face, hands, feet. Monitor urination patterns and urine appearance. Track energy levels and sleep quality. Note any taste or breath changes. Step 2. Medical testing every 6 months after age 55. Complete metabolic panel, creatinine, BUN, GFR, urinalysis with microscopic examination, microalbumin test, detects early protein leakage, blood pressure monitoring. Step 3. Risk factor assessment. Family history of kidney disease, diabetes or prediabetes, high blood pressure history, heart disease or stroke, autoimmune conditions. Step 4. Immediate action protocol. If you have any warning signs, see your doctor within 2 weeks, request comprehensive kidney function tests, start kidney protective lifestyle changes immediately. Consider consultation with nephrologist. These changes can slow, stop, or even reverse early kidney disease. Nutrition protocol. Limit protein to 0.8 grams per kilogram body weight. Reduce sodium to less than 2,000 milligrams daily. Eliminate processed foods and additives. Increase antioxidant-rich vegetables. Stay hydrated with pure water. Supplement support. Omega-3 fatty acids for inflammation. Vitamin D3 for mineral balance. Magnesium for blood pressure. Probiotics for toxin elimination. Antioxidants like astaxanthin. Critical lifestyle changes. Maintain ideal body weight. Exercise regularly, moderate intensity. Manage stress through meditation or yoga. Get 7 to 8 hours of quality sleep. Avoid nephrotoxic medications when possible. Here's why this information could save your life. 1 in 3 American adults is at risk for kidney disease. Kidney disease kills more people than breast or prostate cancer. Early detection can prevent 90% of kidney failure cases. Treatment costs average $90,000 per year for dialysis. Kidney transplant wait time averages 3 to 5 years. But here's the hope. When caught early, stages 1 to 3, kidney disease progression can be stopped or reversed in 70% of cases. If you've watched this entire video, you're clearly serious about protecting your kidney health. Here's exactly what to do. This week, schedule comprehensive kidney function testing. Start the home monitoring protocol. Begin kidney protective nutrition changes. Share this information with family members over 55 urine. This month, get complete medical evaluation if you have warning signs. Implement stress reduction and sleep optimization. Start appropriate supplements after medical consultation. Create accountability system with family friends. Your future. By taking action now, you could prevent kidney failure, avoid dialysis, and add decades of healthy life. The choice is yours. Margaret asked me to share this message. If someone had told me about these warning signs earlier, I could have prevented years of kidney damage. Don't wait like I did. If you're experiencing any of these signs, get tested immediately. It could save your life. Gentlemen and ladies, your kidneys are silently filtering your blood right now, keeping you alive. They deserve your attention and protection. You can continue ignoring these subtle warning signs and hope for the best, or you can take control of your kidney health starting today. If this video has opened your eyes to kidney disease warning signs, please share it with everyone you care about. Early detection saves lives. Don't forget to subscribe and hit that notification bell, because next week I'm revealing the kidney detox protocol that helped Margaret restore 55% of her kidney function in just 6 months. Remember, your kidneys don't have to fail just because you're getting older. With early detection and proper care, they can serve you well into your 90s and beyond. Until next time, this is Dr. James Whitaker reminding you that kidney disease may be silent, but your response doesn't have to be. Take action today. Your future self will thank you.